As we move through life, it's not uncommon to notice changes in our bodies and minds, and yet many of these changes are often brushed off as mere signs of aging. In a world flooded with medical advice, treatments, and health trends, it's easy to overlook the fact that some conditions we experience as we grow older are entirely natural. In this video, we'll explore 7 common conditions that many of us encounter as we age, and why understanding these changes is vital for maintaining our overall health. Stick with us until the end to learn how accepting these natural shifts can lead to a healthier, more fulfilling life. We'll also dive into the importance of staying calm and adopting a mindful approach to avoid unnecessary treatments or anxiety. Before we dive in, please take a moment to like this video. If you haven't subscribed yet, I recommend you do so and hit the notification bell so you never miss any of our future videos. If you enjoy this content, please leave a comment with a 1 to show your support, or 0 if you'd like to see improvements. Your feedback helps me create better videos for you. Now, let's get started. One of the most common experiences as we age is memory decline. As we move into our later years, it's not unusual to find ourselves forgetting things, misplacing objects, or struggling to remember a name or word that just slipped our mind. While these lapses can be disconcerting, they don't automatically mean that we are facing dementia or serious cognitive decline. In fact, these memory lapses are a normal part of the aging process, as the brain undergoes natural changes. As we age, the number of neurons in our brains decreases, which can result in a decline in memory and cognitive processing. This process is completely natural and doesn't always signify a major issue. To counteract these changes, there are several strategies that can help maintain and even improve cognitive health. Engaging in physical exercise is crucial, as it promotes blood flow to the brain, providing essential nutrients to the neurons. Mental exercises are equally important. Activities like reading, solving puzzles, writing, or learning new skills can keep our brains sharp. Instead of fearing forgetfulness, we can embrace activities that support our brain health, ensuring that even as we age, our memory and cognitive function remain strong. Another condition commonly associated with aging is prostate enlargement, or benign prostatic hyperplasia, BPH, which affects many men as they get older. The prostate, responsible for producing seminal fluid, gradually increases in size with age due to the growth of prostate tissue. For most men, this condition doesn't lead to severe discomfort or drastic symptoms. While some men may experience mild urinary issues, such as increased frequency or urgency, these symptoms are generally manageable and don't drastically interfere with daily life. In most cases, prostate enlargement doesn't lead to major health issues, and many men live with this condition without requiring intensive medical treatment. Though BPH is a normal part of aging, it's important for men to monitor their health and seek regular checkups. Prostate enlargement is typically a slow process, and while it may cause mild changes in urinary patterns, it rarely requires aggressive treatment. With regular medical evaluations, men can ensure that any changes in urinary health are addressed appropriately. Blurred vision is another common concern as we age, and it's often linked to the natural changes our eyes undergo over time. One of the most significant changes is the gradual loss of elasticity in the lenses of our eyes, which makes it harder for them to adjust to different distances. This loss of flexibility leads to a condition known as presbyopia, which typically affects people over 40. Presbyopia makes close-up tasks such as reading or working on a computer more difficult, often causing individuals to hold materials further away to see more clearly. Presbyopia is a part of the aging process, but it doesn't mean that vision deterioration is inevitable. Maintaining a healthy lifestyle plays a key role in supporting eye health. A diet rich in vitamins and antioxidants such as vitamin C, vitamin E, lutein, and omega-3 fatty acids can support eye function and potentially reduce the risk of age-related vision issues. Regular physical activity improves blood circulation, which benefits overall eye health. Additionally, routine eye exams are essential, as they allow professionals to detect potential issues such as glaucoma, macular degeneration, and diabetic retinopathy before they reach advanced stages. It's also important to note that vision problems in the elderly can sometimes be linked to factors beyond aging alone. Genetics, prior eye injuries, and conditions like diabetes and high blood pressure can all contribute to vision impairment later in life. Furthermore, prolonged exposure to UV light or blue light from screens can impact eye health, making protective measures such as wearing sunglasses and using blue light filters all the more important. Osteoporosis is another condition that becomes more prevalent as we age. This condition, characterized by the thinning of bones and increased risk of fractures, affects millions of older adults. Osteoporosis occurs when the bones lose their density, making them more fragile. One of the main contributors to this weakening is the gradual depletion of calcium, a crucial mineral that helps maintain bone strength. As we age, our bodies become less efficient at absorbing calcium, leading to a reduction in bone density. While osteoporosis can increase the risk of fractures, there are steps we can take to protect our bones. Weight-bearing exercises, such as walking, running, or strength training, can help improve bone density and prevent further weakening. Consuming a diet rich in calcium and vitamin D is essential for bone health, as these nutrients help to strengthen bones and maintain their integrity. In some cases, medications may be prescribed to help prevent bone loss, but these measures are most effective when combined with lifestyle changes like exercise and proper nutrition. Another common condition that affects many people as they age is joint pain, which often results from the natural wear and tear that occurs over time. Joints, such as those in the knees, hips, and shoulders, are particularly susceptible to arthritis, a condition that causes inflammation and pain. Although arthritis is often associated with aging, it can also be influenced by genetics, previous injuries, or lifestyle factors such as obesity. Managing joint pain involves a combination of regular exercise, maintaining a healthy weight, and possibly physical therapy. In some cases, medications or even surgery may be necessary, but these should be considered after careful consultation with a healthcare provider. Finally, sleep disturbances become increasingly common with age. Many older adults find it harder to fall asleep or stay asleep throughout the night. This can be attributed to a variety of factors, including changes in sleep patterns, medical conditions, or even the natural aging of the brain. Sleep is essential for overall health, and quality rest can significantly impact our physical and mental well-being. To improve sleep quality, it's important to establish a regular sleep routine, avoid caffeine or heavy meals before bedtime, and create a comfortable sleeping environment. If sleep issues persist, it's crucial to consult a healthcare provider to rule out any underlying health conditions or sleep disorders. As we age, it's important to recognize that many of these changes are a natural part of life. By staying proactive about our health, embracing these changes, and focusing on maintaining a healthy lifestyle, we can navigate the aging process with greater ease and vitality. A calm mindset and regular checkups are your best allies as you move through your golden years. As we age, our bodies go through several changes that can have significant impacts on our overall health. One of the most important aspects to consider is bone health. Bone density naturally decreases over time, making bones more fragile and susceptible to injury. This gradual loss of bone mass can go unnoticed for years, with many individuals not realizing they have osteoporosis until a fracture occurs. These fractures can happen from something as minor as a small fall, or even from daily activities like bending over or lifting an object. Common fracture sites for people with osteoporosis include the hip, spine, and wrist. A hip fracture, for instance, can have serious consequences, often leading to a significant loss of mobility and independence. Recovery may require extensive medical care, rehabilitation, and sometimes even surgery. Spinal fractures can also have long-term effects, causing chronic pain, postural changes, and a reduction in quality of life. This highlights the importance of addressing bone health early on before such issues arise. There are several factors that contribute to the development of osteoporosis. Age is a major factor, as bone density typically begins to decline after reaching peak bone mass in young adulthood. Gender also plays a critical role, with women, especially those who are postmenopausal, being at a higher risk due to a decline in estrogen, a hormone that helps maintain bone density. Other risk factors include family history, smaller body frame, sedentary lifestyle, smoking, excessive alcohol intake, and poor nutrition, particularly a lack of calcium and vitamin D. Preventing osteoporosis involves a comprehensive approach that focuses on nutrition, exercise, and healthy lifestyle choices. A well-balanced diet is key to maintaining strong bones, and calcium is an essential mineral for bone health. For adults, the recommended daily intake of calcium ranges from 1,000 to 1,200 milligrams, depending on age and gender. Including calcium-rich foods in your diet, like dairy products, leafy green vegetables such as kale, broccoli, and collard greens, fortified cereals, and plant-based milk alternatives can significantly improve calcium intake. In addition to calcium, vitamin D plays a vital role in helping the body absorb calcium. Sunlight exposure is one of the most natural ways to get vitamin D, but it can also be found in fatty fish, fortified dairy products, and certain supplements. A combination of these nutrients, along with a healthy, balanced diet, is essential for optimal bone health. Regular physical activity is equally important in preventing osteoporosis. Weight-bearing exercises such as walking, jogging, dancing, and resistance training are excellent ways to stimulate bone growth and improve bone density. These activities put stress on the bones, which encourages them to become stronger over time. It is generally recommended to engage in at least 150 minutes of moderate intensity exercise each week, along with muscle strengthening activities on 2 or more days. It's also important to stay proactive by scheduling regular checkups with healthcare professionals, especially if you're at a higher risk for osteoporosis. Bone density tests, such as dual energy X-ray absorptiometry, DEXA, can help assess bone mineral density and detect early signs of osteoporosis. Early detection allows for timely interventions that can help slow or stop bone loss. In some cases, your doctor may recommend medications to help improve bone strength. In addition to diet and exercise, lifestyle changes like quitting smoking, reducing alcohol intake, and avoiding excessive caffeine can help reduce the risk of osteoporosis. It's crucial to take a proactive stance on bone health to maintain a strong and independent life as we age. Another health concern that often goes unnoticed is the formation of nodules, which are abnormal lumps or masses that can develop in various parts of the body. These growths can appear in organs such as the lungs, thyroid, liver, kidneys, and even the skin. Nodules can develop for a variety of reasons, including inflammation, infections, hormonal imbalances, or even benign growths. It is important to note that not all nodules are harmful. Many are non-threatening and do not require medical treatment. However, some nodules may indicate more serious health conditions, so it's important to understand the potential causes and risks. For example, thyroid nodules can develop due to hormonal imbalances or the presence of benign cysts. Lung nodules may arise from infections, granulomas, or benign tumors. Chronic inflammatory conditions like rheumatoid arthritis or sarcoidosis can also lead to the formation of nodules. When a nodule is detected, either through a physical exam or an imaging study, healthcare providers will follow a systematic approach to evaluate its nature. The first step typically involves a thorough medical history and a physical examination to gather information about any symptoms the patient may be experiencing. This helps to determine whether the nodule is related to any other health conditions. From there, doctors may use imaging techniques, such as ultrasound, CT scans, or MRI, to assess the size, shape, and location of the nodule, as well as to evaluate its relationship with surrounding tissues. This information helps determine whether the nodule is benign or potentially harmful. In some cases, a biopsy may be recommended to take a tissue sample from the nodule for further analysis. The biopsy allows healthcare providers to determine whether the nodule is benign or malignant, providing valuable insight that can guide treatment decisions. It's important for patients and their families to understand that most nodules are not harmful and often do not require aggressive treatment. Many nodules can be monitored through follow-up appointments and periodic imaging studies to track any changes in size or appearance. For benign nodules, a watchful waiting approach may be recommended. In other cases, treatment for the underlying condition may be necessary, or surgical intervention might be considered if there is concern about malignancy. Effective communication with healthcare providers is crucial for understanding the significance of a nodule and making informed decisions about care. Finally, many people also struggle with insomnia, particularly as they age. What was once a simple and automatic process, falling asleep after a long day, becomes more difficult as we get older. This disruption in sleep patterns can be caused by a variety of factors. One major factor is the misalignment of our biological clock, or circadian rhythm, which regulates our sleep-wake cycle. As we age, this rhythm can become out of sync with our daily routine, making it harder to establish a consistent sleep pattern. Lifestyle changes, such as retirement or reduced physical activity, can also contribute to sleep disturbances. Stress and anxiety, which tend to increase with age, can further exacerbate insomnia, making it difficult to relax at night. Physical discomforts, like joint pain or frequent trips to the bathroom, can also disrupt sleep. Despite these challenges, insomnia is not an insurmountable problem. With the right strategies, it is possible to improve sleep quality and overcome sleep difficulties. Approaches like practicing good sleep hygiene, establishing a regular bedtime routine, reducing stress, and engaging in relaxation techniques can all help promote better sleep. It's important to acknowledge that sleep problems are common as we age, and addressing them with patience and proactive strategies can help ensure a better night's rest. A consistent sleep routine is essential for maintaining optimal health. This means going to sleep and waking up at the same time every day, even on weekends. Having this consistency strengthens your body's internal clock, making it easier to naturally drift off to sleep and wake up feeling refreshed. One of the best ways to improve your sleep is by creating a calming bedtime ritual. This could include activities like reading, meditating, or stretching, which signal to your brain that it's time to wind down. Taking a warm bath or practicing gentle yoga can also help your body relax before bed, preparing you for a restful night. Another key factor in ensuring a good night's sleep is the environment. A bedroom that's dark, quiet, and cool is crucial for quality rest. You might want to use blackout curtains, a white noise machine, or comfortable bedding to enhance your sleep space. This can help you fall asleep faster and stay asleep longer. Your diet also impacts your sleep. Avoiding caffeine and heavy meals a few hours before bed can prevent discomfort and sleep disruptions. Furthermore, practicing mindfulness and relaxation techniques during the day, such as deep breathing exercises or progressive muscle relaxation, can help you feel calm when it's time to sleep, making it easier to transition from wakefulness to rest. By incorporating these practices into your routine, you'll be setting yourself up for better sleep and overall well-being. But remember, it's not just about the quantity of sleep you get, but the quality. Healthy habits like these will help you wake up feeling more energized and ready to take on the day. If you're still here and finding these tips helpful, let me know by commenting 3 below. I'd love to hear from you, and I appreciate you taking the time to watch this. Now, let's talk about a condition that affects many as we age: arterial plaque. Also known as atherosclerosis, this is the buildup of fatty deposits, cholesterol, calcium, and other substances in the arteries. Over time, this can cause the arteries to harden and narrow, which can severely affect blood flow. Atherosclerosis is often seen as a natural part of aging, similar to the wrinkles that develop on our skin. Statistics show that nearly 40% of individuals over the age of 40 are affected by arterial plaque, and by age 60, this number can approach 100%. With this widespread prevalence, it's important to recognize the risks that come with this condition, such as heart attacks, strokes, and peripheral artery disease. However, the good news is that you can take proactive steps to prevent and manage arterial plaque formation. A heart-healthy lifestyle is key. Regular physical activity improves circulation, lowers blood pressure, and helps reduce cholesterol levels, all of which contribute to healthier arteries. Adopting a balanced diet is equally important. Eating a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats can protect your heart and blood vessels. Omega-3 fatty acids found in fish and antioxidants found in berries are particularly helpful in combating arterial plaque buildup. Lifestyle choices, such as avoiding smoking and limiting alcohol intake, also play a crucial role in heart health. Smoking damages the walls of the arteries and accelerates plaque buildup. Maintaining a healthy weight and managing stress are also important components of preserving arterial health. In addition to these habits, regular checkups can help monitor cardiovascular health. Routine screenings for blood pressure and cholesterol can identify risks early, allowing for intervention before serious complications arise. In some cases, healthcare professionals may recommend medication to help manage cholesterol or blood pressure. In conclusion, while arterial plaque is a common consequence of aging, there are many ways to reduce the risks associated with it. Through regular exercise, a balanced diet, avoiding harmful habits, and keeping up with health checkups, you can maintain a healthy cardiovascular system and lower your chances of developing serious health issues as you age. Now, let's explore an important topic: overtreatment. When it comes to healthcare, overtreatment can cause more harm than good. Though medications and treatments are designed to help, they often come with side effects that can negatively impact the body, especially when used excessively. For example, overusing antibiotics can harm your gut flora, which is essential for digestion and immunity, and may even contribute to antibiotic resistance. Similarly, excessive radiation during cancer treatment can cause damage to healthy tissue, increasing the risk of secondary cancers. Unnecessary surgeries also carry risks. Complications such as infections, prolonged recovery, and long-term impairment of physical function can arise. Beyond the physical side effects, overtreatment can also take a toll on mental health. The anxiety and fear associated with aggressive treatment plans can exacerbate feelings of stress and depression. So how can we prevent overtreatment? As we age, we often become more concerned about our health, but it's important to prioritize a healthy lifestyle and adopt preventive measures instead of relying solely on medical interventions. Establishing a daily routine that includes adequate sleep, regular exercise, and a balanced diet can help ward off illness and reduce the need for excessive treatments. Getting enough sleep is particularly important. A consistent sleep schedule supports the body's natural recovery processes and enhances overall health. Avoiding late-night habits and focusing on wellness routines can help maintain good physical and mental health. Nutrition is also essential for disease prevention, especially for older adults. Consuming a variety of nutrient-dense foods like fish, lean meats, eggs, fresh vegetables, and fruit supports your body's immune system. Limiting the intake of unhealthy foods high in fats, sugars, and salts can also lower your risk of chronic diseases. Physical activity is another key element. Seniors should aim to include light exercise in their daily routine, whether it's walking, yoga, or Tai Chi. Exercise keeps the body strong and helps prevent disease. Lastly, maintaining a positive outlook is crucial for health. Approaching life with optimism can reduce stress, strengthen your immune system, and improve your overall well-being. Social connections, whether with family or through community activities, provide emotional support, and help older adults stay engaged in life. As we navigate the aging process, it's important to stay informed, trust scientific knowledge, and filter out misleading information. A focus on healthy habits, such as exercise, a balanced diet, and mental well-being, will give you the resilience needed to face life's challenges. I hope these insights were helpful as you continue your journey toward healthy aging. Please share one takeaway you plan to implement in the comments below. If you enjoyed this video, don't forget to like, share, and subscribe. Let's continue learning and supporting each other as we grow healthier together. See you in the next video.